Topic of discussion is on differences between skeletal muscle and cardiac muscle. As you all know, skeletal muscle and cardiac muscle both are striated muscle. Here also there are differences, although it is both are striated, but still there are differences. And this question is very common. You all must know what are the differences between skeletal muscle and cardiac muscle. If we talk about histological finding, this is skeletal and this is cardiac muscle. If we talk about histological findings, then skeletal muscle is cylindrical, length of the length of the fiber is 1 to 40 millimeter, and the width is 10 to 100 micron. But here it is short cylindrical, and length and width is also not same as we have mentioned in case of skeletal muscle. Here we have, there is no syncytium. Syncytium means the skeletal muscle fibers, if we talk about these fibers, are not united. They are not united. There is no connection. Cardiac muscle, if we look at the cardiac muscle fibers, they are interlinked. Cardiac muscle link is there between between fibers, link is there. So this is called characteristics of syncytium. This syncytium characteristics we can see in case of cardiac muscle. Cell to cell conduction is there. If we stimulate one fiber, this is one fiber 1, this is fiber 2, this is fiber 3, this is fiber 4, this is fiber 5, 6, 7, 8, 9, 10, 11. So if we stimulate this fiber, all the fibers will be stimulated. So that is the property of syncytium we can see in case of cardiac muscle. But in case of skeletal muscle, there is no cell to cell conduction. Even this is fiber 1, this is fiber 2, this is fiber 3, this is fiber 4, and this is fiber 5. If we stimulate, maybe there will be a stimulation of only one fiber, or maybe there will be a stimulation of 1, 2, 3 fiber, or 2 fiber, not all fibers. But here, if we stimulate at one point, all the fibers will be stimulated in case of cardiac muscle. So this is the property of syncytium we can see in case of cardiac muscle. And then if we look at the fibers, this is T-tubule, we can see here. Try to understand what I am drawing here. Here, this is the sarcolemma. This is sarcolemma. And under this sarcolemma, we can see the multiple nucleus. This is the nucleus, multiple nucleus multiple nucleus, multiple nucleus we can see. But here, if we talk about one fibers, here we have the T-tubule, sarcolemma is there, T-tubule, but only single nucleus is there, single nucleus. But here we have multiple nucleus. And another interesting point you must note that here we have actin filament, here we have actin filament, here we have actin filament, and this actin filament we have Z line. Here we have actin filament, here we have actin filament, here we have actin filament, here we have actin filament. But this T-tubule which I have drawn here, this T-tubule in case of cardiac muscle, this T-tubule is near to Z line, This T-tubule is near to Z line. Here this T-tubule is near to Z line. But here the T-tubule is there and T-tubule is near to A and I band. Which one is? This is the myosin, this is myosin, this is myosin, and this is the myosin. So this is A band. Which one is A band? This is the A band and this is I band. So this T-tubule is near to A and I band, not near to Z line. Again I am repeating. Here the T-tubule system is there, but this T-tubule is near to Z line. But here this is not near to Z line. This is near to A and I band. That is why the process of contraction becomes quick. Process of contraction in case of skeletal muscle is quick, but here the process of contraction is slow. It takes time to form cross bridges. Now coming to the arrangement of actin and myosin, structure of actin and myosin, both are same. There is no difference. Actin, myosin, there is no difference. Mechanism of contraction also there is no difference. Whatever the steps of contraction here, steps of relaxation here also same. But the difference is here we have endoplasmic reticulum. Here we have endoplasmic reticulum, and this endoplasmic reticulum is filled with calcium ion. And this is adequate calcium ion is there. For contraction, this fiber does not need calcium ion from extracellular space. Does not need extra calcium ion from extracellular space. But here, the endoplasmic reticulum is there. Endoplasmic reticulum is filled with calcium ion. But because of inadequacy of calcium ion here, this fiber needs extra calcium ion from extracellular space. Extracellular space. The calcium ion coming from extracellular space. Again I am repeating. Here endoplasmic reticulum is there. Endoplasmic reticulum is filled with calcium ion, but this calcium ion is not adequate. This fiber, cardiac fiber, needs calcium ion at the time of contraction from extracellular space. Now coming to the other differences, here if we draw the electrical events here we draw the electrical events here. Electrical events. That is, in case of skeletal muscle, the resting membrane potential is minus 70 millivolt. And it looks like this. This is 1, 2, 3, and this is millisecond. So total duration of action potential is 3 millisecond here. Resting membrane potential of the skeletal muscle fiber is minus 70 millivolt. It goes up to plus 30 millivolt. And here we have phases of depolarization, phases of depolarization, phases of repolarization, phases of depolarization, phases of repolarization, and then positive after hyperpolarization. But in case of cardiac muscle, here the resting membrane potential is minus 90 millivolt, plus 30 millivolt. So here it is the depolarization, phases depolarization, then plateau phase, then it is repolarization, and this is positive after hyperpolarization. 4 is positive after hyperpolarization, positive after hyperpolarization. So these are the phases we have if we talk on electrical events present in the cardiac muscle. First, again I am repeating, the resting membrane potential is minus 90 millivolt. Total duration of action potential is 250 to 300 millisecond, and here it is millivolt. The plateau phase is there, but here there is no plateau phase. In this plateau phase, actually there is an entry of calcium ion, but since the calcium ion is there, adequacy is there, the cistern is filled with the calcium ion, adequate calcium is there, so if this fiber does not need calcium from extracellular space. So this process is the first process. The contraction and relaxation is the first process, but this is the slow process. This muscle gets fatigued, but this muscle does not get fatigued because the total duration is 300 milliseconds. Here the total duration is 2 to 3 milliseconds. So in this duration, if we talk about the again the molecular steps of muscle contraction, the steps are same, there is no differences, but here there is a chance, or we can say skeletal muscle will be fatigued if there is no plenty of ATP available. But here, since the process is a slow process, ATP can join easily, there will be a fresh molecule of ATP, so that is why till death there will be a contraction and relaxation of the cardiac muscles. So heart will be contracting and relaxing till death. Heart does not get fatigued. So these are the differences. I think this information will be sufficient for you all.